Hi, this is Dr. Siegfried, and thank you very much for coming to my YouTube video station again. Today we're going to be talking about the shoulder, and I'm always studying about the shoulder because I still pitch semi-professional baseball, and I'm always concerned about my own shoulder. And what we're going to be talking about today are rotator cuff tears. In fact, we're going to be summarizing a recent Journal of Bone and Joint Surgery study where they showed the treatment of non-traumatic rotator cuff tears, which was a randomized controlled trial of so many patients, and they followed them up after a year. One group had surgery, one group had conservative care, which was physical therapy. When it says non-traumatic, that means wear and tear, like a guy that's using a hammer all the time, or somebody that's out here with a computer for many years, lifting something that's too strenuous. That could be a wear and tear thing. But that's different than a fall, or when you get hit, like playing football, or if you fall like this and you tear it. So trauma basically means some kind of force, whereas what we're looking at here is non-traumatic, which is what we call wear and tear over time. And the journal, like I said, the Journal of Bone and Joint Surgery is one of the top medical journals in the orthopedic field. So when people talk about a rotator cuff tear, usually they're talking about what's called a supraspinatus tendon, which is the tendon that actually comes down along here, along the shoulder here, and you'll know, well, a lot of times when people have a tear in their shoulder, this activity here, this motion here is just excruciating. And so over time, people do different things for it. They get injections, they do exercise, et cetera, and they try to avoid surgery. Well, that's what this study did. They showed what happens with people that have surgery and the people that don't have surgery. But in any case, the supraspinatus tendon is what is referred to a lot of times as a rotator cuff problem, and it's this motion here that really bothers you. Or it could be this motion here, but most commonly it's like this. So the problem is that the supraspinatus tendon was torn. And they didn't say exactly how much it was torn because there's different grades of tear, but they took people They took people from the ages of 55 to 79, and there was 180 of these shoulders, as they referred to them in the study, and they just divided them up into 3 groups. So the solution to this rotator cuff problem, tears that were done, the solutions that were given were, number one, they used what was called acromioplasty and physiotherapy, which is where they shaved down the bone here, and once they healed from that surgery, then they did physical therapy. Another one was strictly physical therapy. They didn't say whether it was cortisone shots or they didn't say what the physical therapy was, but it wasn't surgical. So that was the second one. And then the third one is where they did what's called acromioplasty, the rotator cuff repair here, the supraspinatus tendon repair, and then physical therapy. So there was 3 types of treatment. Physical therapy, they shaved the bone down here, and then the other one and physical therapy, and then the third was they shaved the bone here and repaired this tendon and physical therapy. So that was the solution that was done, and the results were really interesting. After 1 year, they followed they followed the patients 1 year after they were completely released from care, and the average age of each group was 65. The results were this. After 1 year, there was no difference between the operation or the surgery in the non-traumatic supraspinatus tendon tears and the conservative treatment. And in fact, the study, the Journal of Bone and Joint Surgery, recommended that the primary treatment for a non-traumatic rotator cuff tear should be conservative. They just didn't delineate what that was. Simply, that meant no surgery. So what they're actually recommending is you shouldn't have surgery if you have a rotator cuff tear, if it's due to wear and tear, when you're anywhere from 55 to 75. So basically, no surgery, conservative treatment, but again, conservative treatment can mean anything. So I want to give you my opinion, because in my office I treat these problems and treat a lot of them over the years. Plus I have my own example that I'm constantly working on. It's not torn. Actually, it might be torn. I haven't had an MRI, but it might be torn because it hurts a lot, but I haven't gotten one. So the point is, in my office, what I do with patients is I always review it from the standpoint of this. I always look at the postural aspect of it. So this would be my conservative approach to a rotator cuff tear. What's the postural component? Because as I've said in my other videos, if you're like this or your posture's off, it's going to be jamming the joint, putting pressure on the nerves, etc. So we look at the posture. And along with that, we look to see if the posture's off. We know that there's a nervous system component, which means the nerves out to here are pinched. Then we look at whatever exercises you might be doing or may need to be doing to strengthen the shoulder girdle. And then we show you traction maneuvers to do at home to take the stress off the joints. And then we show you, and then we have a nutritional protocol as well. So that's pretty much my protocol. And everybody's different, of course, but over the years I've developed my own. And if you're interested, I'd be happy to discuss it with you sometime. You can just get in touch with me from you can give me a call, which is listed here. Or you can contact me through my website, write me a note, make an appointment that way. So I just wanted to report to you on this very recent study in the Journal of Bone and Joint Surgery regarding rotator cuff tears in the shoulder and what you can do about them conservatively, because you don't necessarily need surgery. Thank you very much for watching, and we'll see you next time.